Hello everyone, welcome to our YouTube channel for Nurses Preparation. I am Neeraj Kumar Kaithal. Today we are presenting few important points from obstetric and gynecology subject. This video is especially prepared for the upcoming AIIMS norcet exam 2021. I just want to inform you all the videos that we are publishing here on For Nurses Preparation YouTube channel also available in Hindi language in our Hindi channel. Its name Education Experience Expo. If you want to learn with us in Hindi language, if you want to prepare with us for AIIMS norcet exam 2021 in Hindi language, so you can join this channel also. So let's begin our today's video. First point, germ cells, also known as sex cell. In males, spermatozoa or sperm is known as germ cell. In female, ova is a germ cell. Germ cells produce the organism. Germ cells produces the organism. Germ cell have haploid number or single set of chromosome. Germ cells have haploid number of chromosomes. Next point, Bartholin's gland. Bartholin's gland. Bartholin glands are 2 in number, each on lateral wall of the vestibule of vagina, near the vaginal opening at base of labia majora. Let's talk about the location of Bartholin gland. Bartholin gland is situated near the vaginal opening at the base of labia majora, each on lateral wall of vestibule of vagina. Bartholin glands are situated near the vaginal opening at the base of labia majora and each on lateral wall of vestibule of vagina. Now let's talk about the function of this Bartholin's gland. Bartholin gland produces mucus during sexual arousal and intercourse for lubrication. This is the most important function of the Bartholin gland. It secretes mucus that lubricate the vagina and during the sexual arousal and intercourse. Next point, BSE stands for breast self-examination. Breast self-examination is a screening test. This test is helpful for the detection of breast cancer. In women who are in reproductive age, they must perform BSE after the 7 days of menstrual period. In the women who achieve their menopausal state, they can perform the BSE one fixed date of each month. You can take screenshot for your revision purpose. Now let's talk about the few important points from the breast self-examination that can be asked in the exam. Point 1. Perform monthly 7 to 10 days after menses. Best time to perform breast self-examination is after starting of menstruation period between 7th to 10th day of menstrual period. This is the best time to perform breast self-examination. Next point, after menopause or hysterectomy, perform on a fixed day every month. Women who have menopause or hysterectomy, means removal of uterus, they can perform breast self-examination at a fixed day every month. At a fixed day every month. Next point, use opposite hand to examine breast. To perform breast self-examination, females must use opposite hand. For the left side breast, use right hand. For the right side breast, use left hand. Next point. Perform breast self-examination during bath and shower and when skin is slippery with soap. Best time to perform breast self-examination is during shower or bath time because this time skin is slippery with soap. Next, maximum number of oogonia reaches at 20th week of female fetus. It is approximately 7 million in number. Maximum number of oogonia found in female fetus during 20th week of gestation. It is approximately 7 million in number. 1 million equals 10 lakh. You can take screenshot. Next point is oogonium are the primordial cells from which oocyte originate. Oogonium are the primordial cells from which oocytes originate. Oogonium convert into oocyte and oocyte now convert further into ovum. Next, at birth approximately 2 to 20 lakh primary oocyte present in each ovary. This is the maximum number of oocyte present in the lifetime. At birth, 2 to 20 lakh primary oocytes present in each ovary. Important. Next point. 0.3 to 0.5 degrees centigrade basal body temperature increases after ovulation due to increased production of progesterone. After ovulation, due to increased production of progesterone hormone, body temperature increases approximately 0.3 degrees centigrade to 0.5 degrees centigrade. If we convert this degree centigrade parameter into the Fahrenheit, we can say 1 degree Fahrenheit approximately. Next, average blood loss in menstrual cycle is 30 to 40 ml. Next, constant phase of menstrual cycle is luteal phase. This luteal phase is also known as ovulatory phase or secretory phase. This phase occurs after ovulation to the beginning of next menses, that is approximately 15 to 28th day. We all know ovulation occurs in menstrual cycles 14th day. After the ovulation means 15th day to last day 28 days. The time between this 15 to 28 days known as constant phase of menstrual cycle. Next point. Ovulation occurs 14th day. As we told previously, drug of choice for ovulation is clomiphene citrate. Drug of choice for ovulation is clomiphene citrate. Next point, important. Spin-Burkitt appearance of cervical mucus is sign of ovulation. Spin-Burkitt appearance of cervical mucus is sign of ovulation. Next point है, Fern test is used to assess ovulation. If you want to assess ovulation in a female, you can perform Fern test. Next, uterus is having 3 layers. Uterus is having 3 layers. These are, outer layer is known as perimetrium. Middle layer is called myometrium. Inner layer is called endometrium. Next, Menopause. Menopause is a permanent stop of menstrual cycle. Menopause is a permanent stop of menstrual cycle in a female. Menarche is a beginning of menstrual cycle. Next point. Physiological cause of menopause. Decreased level of ovarian hormone, mainly estrogen and progesterone. We can simply say ovary secretes two important hormones, estrogen and progesterone. If their level decreases, it can cause menopause. Next point. Premature menopause. Before age 35, natural or artificial. If in a female, menopause occurs before the age of 35 years, it is called premature menopause. It can be natural or artificial. Due to this premature menopause, few complications can a woman face. These are: first, vasomotor instability. In this condition, women have hot flushes and night sweats. Second is incremental bone loss. Due to this, women can suffer with osteopenia or osteoporosis. Next point. Increased cardiovascular risk. Due to premature menopause, cardiovascular risk increases in the female, and she also faces infertility. Now let's talk about the next point. Female urethra, its length approximately 4 centimeters or 1.5 inches. As compared to the male urethra, female urethra is very small. So, as compared to the male, females have more chances to get infected with urinary tract infection. Urinary tract infections most common causative organism is E. coli bacteria. Next point. Endocervical polyp, cervical malignancies and endometrial polyp may cause intermenstrual bleeding. Intermenstrual bleeding means bleeding between the menstrual cycles, abnormal days, bleeding during the menses. It may be occur due to the presence of endocervical polyp, cervical malignancies, endometrial polyp. Next point. Polycystic ovarian syndrome. It is also known as Steen-Leventhal syndrome. In this condition, symptoms appear due to elevated male hormone androgen into female. Polycystic ovarian syndrome is the condition in which females have increased amount of male androgen hormone. Important characteristics of polycystic ovarian syndrome is infrequent or prolonged period, infrequent or prolonged menstrual cycle or period, excess release of luteinizing hormone, anovulation. Anovulation means failure to ovulate, hirsutism, infertility, and ovarian cyst. Let's repeat it again. Polycystic ovarian syndrome is also known as Steen-Leventhal syndrome. In this condition, symptoms occur due to the increased androgen hormone in females. Important characteristics of the Steen-Leventhal syndrome are infrequent or prolonged menstrual period, excess release of luteinizing hormone, failure to ovulate, hirsutism, infertility, and ovarian cyst. Next point. Postmenopausal atrophy can cause dyspareunia. Dyspareunia means painful intercourse. To treat this condition, estrogen containing topical vaginal creams are used that reduces friction associated discomfort. In post-menopausal women, dyspareunia condition may occur. Dyspareunia means pain while having intercourse. To treat this situation, we can use estrogen containing topical vaginal creams. This cream reduces friction associated discomfort. You can take a screenshot. Let's have a quick revision about the important terms related with the menstrual cycle. First is dysmenorrhea. Dysmenorrhea is a painful menstruation. Women have pain, excessive pain during the menstruation. This is called dysmenorrhea. Menorrhagia. Menorrhagia is a condition in which excessive menstrual bleeding or menstrual bleeding that lasts longer than 7 days. If a female is having excess bleeding during menstrual period or she having the bleeding more than 7 days, this condition is known as menorrhagia. Next, amenorrhea. Amenorrhea means absence of menstruation. Absence of menstruation is known as amenorrhea. Next, polymenorrhea. As the name shows, polymenorrhea. Menstrual bleeding occurs regularly but at interval of less than 21 days. Simply we can say the normal duration of menstrual cycle period reduced from 28 days to 21 days, and in this bleeding is cyclic but the period's length is reduced from 28 to 21 days. This condition is called polymenorrhea. Next point, menometrorrhagia. Menometrorrhagia is a excessive bleeding during and between menstrual period. Menometrorrhagia is a excessive bleeding during and between menstrual period. Next point, metrorrhagia. What is metrorrhagia? Intermenstrual bleeding means irregular bleeding between regular menses, may be associated with either benign or malignant condition. Metrorrhagia is a condition in which the length of the menstrual period is 28 days, but bleeding occurs in between the cycle and the cause related with the benign or malignant condition. This situation is called metrorrhagia. Last is primary amenorrhea. Primary amenorrhea is a delay in menarche until age 16. If a female not get its first menstrual cycle until age 16, this condition is known as primary amenorrhea. You can take a screenshot of this slide. Friends, if you think this video is beneficial for you, then please click upon the like button. Thank you. Now let's talk about the next point. PID. PID stands for pelvic inflammatory disease. Pelvic inflammatory disease. Causes. What is the pelvic inflammatory disease? In this, infection of uterus, fallopian tube and adjacent pelvic structures occur. Pelvic inflammatory disease is a condition in which uterus, fallopian tube and adjacent pelvic structures get infected. What are the important causes of pelvic inflammatory diseases? First is infection, and the most common cause of infection are Chlamydia trachomatis and Neisseria gonorrhoeae. And the second important cause is postpartum hemorrhage. Pelvic inflammatory disease is an infection of uterus, fallopian tube and adjacent pelvic structures due to infection mostly caused by the Chlamydia trachomatis and Neisseria gonorrhoeae. And the other important cause is postpartum hemorrhage. Now let's talk about the next point. Rectovaginal fistula. First, let's talk about this word fistula. Fistula means abnormal opening or abnormal connection. Fistula is an abnormal opening or abnormal connection between two organs. Here the name shows rectovaginal fistula. We can understand a abnormal opening between rectum and vagina is known as rectovaginal fistula. Let's see the definition. Abnormal opening between rectum and vagina known as rectovaginal fistula. In this condition, perineal care is very important to prevent infection. Next point. Vasico-vaginal fistula. Again, fistula is an abnormal opening between two organs. Now, Vasico. Vasico is the word that always denoting bladder. So, let's see the definition. Abnormal connection between urinary bladder and vagina in females is known as vasico-vaginal fistula. Vasico-vaginal fistula is an abnormal opening or connection between urinary bladder and vagina. Next point. DUB. DUB stands for dysfunctional uterine bleeding. Dysfunctional uterine bleeding. Next point. Endometritis. Endometritis, it is an inflammation of lining of uterus. Inflammation of the lining of uterus is known as endometritis. Next point, important. Salpingitis. Salpingitis is the inflammation of the fallopian tube. Inflammation in fallopian tube known as salpingitis. Important cause of salpingitis is sexually transmitted disease. Next point is vaginal douche. What is that? It is a gentle, low pressure antiseptic irrigation of vagina by povidone iodine solution to treat foul smelling and vaginal discharge. If a female is suffering with foul vaginal smelling and abnormal vaginal discharge condition, we can use vaginal douche as a treatment. In this, we irrigate the vagina with povidone iodine solution. Next point, douching can upset normal vaginal flora and vaginal pH, thus increase chance of vaginal infection. When we perform vaginal douche in female, we use povidone iodine solution. This solution can cause death of the bacteria or bacterial flora present in the vagina. Lactobacillus bacteria maintains the acidic pH of the vagina. Due to this highly acidic pH, infection are prevented in the vaginal region. If we remove the bacteria with the help of povidone iodine solution, there is a chances of infection increases. Next point, abnormal proliferation of uterine endometrial tissue outside the uterus called endometriosis. Endometriosis is a condition in which uterine endometrial tissue comes outside the uterus. Next point, dysuria. Dysuria is a painful urination. Pain while urinating is known as dysuria. Next point, Candidiasis, that is also known as moniliasis. It is a fungal infection and its main cause or most common causative organism is Candida albicans. Candida albicans is a fungus that causes candidiasis disease. Next point, Aries spatula is used for sampling from surface of vaginal mucosa, cervix and cervical canal. If you want to collect material sample for diagnosis purpose from the surface of vaginal mucosa, cervix or cervical canal, you have to use Aries spatula. Next point, colposcope to examine vagina and cervix through magnifying lens. Colposcope is used in the examination of vagina and cervix. You can take screenshot. Next point is bilateral salpingo oophorectomy. What is this? It is a removal of both ovaries and fallopian tube. If a doctor prescribes someone to remove both ovaries and fallopian tube, this condition, this order is written as bilateral salpingo oophorectomy. Next, cystocele or vasicocele. Cystocele or vasicocele means bladder hernia that protrudes into vagina. Cystocele or vasicocele is a bladder hernia that protrudes into the vagina. Next, rectocele. Rectocele is a herniation of the posterior vaginal wall with the anterior wall of the rectum through the vagina. Let's read it again. Rectocele is a herniation of posterior vaginal wall with the anterior wall of the rectum through vagina. Herniation in the posterior vaginal wall into the anterior wall of the rectum through vagina. Next, enterocele. Enterocele, as the name shows, entero means intestine. Hernia of intestine through vagina is known as enterocele. Enterocele is a hernia of intestine through the vagina. Next, endocervicitis. Endocervicitis is the inflammation of the mucous membrane that lines the uterine cervix called endocervicitis. Inflammation of the mucous membrane that lies in uterine cervix called endocervicitis. Endocervicitis. You can take a screenshot of this slide for your revision purpose only. So friends, this was our today's video. How was the video? Please leave a feedback in comment section below. If you think this video is helpful, then please click upon the like button, share this video with your friends and subscribe our YouTube channel for nurses preparation for more such interesting videos regarding AIIMS norcet exam preparation 2021. Let's close this section and meet after some time. All the best.